All the world's a stage, and all the men and women merely players. And one man in his time plays many parts, his acts being 7 ages. The newborn, the toddler, the schoolboy, the lover, the decision maker, the elderly. Last scene of all that ends this strange, eventful history is second childishness and mere oblivion. Sans teeth, sans eyes, sans taste, sans everything.
Sans teeth, sans eyes, sans taste. We've come a long way since Shakespeare's time. And in fact, the bard's immortal words may no longer apply to the elderly of today. Medical progress is slowly leading towards healthier and more active old age, longer lives, and greater contribution to society.
You don't have any teeth there, but you've got some coming. And I still have all mine.
It is also a fact that people no longer need to lose their teeth prematurely. The progress achieved in the field of oral health over the years has been spectacular, and it has become increasingly evident that the health and well-being of a person is largely linked to the state of health of his or her mouth. We now know much about what causes oral health problems and how to avoid them. The incidence of these problems has been decreasing for about 30 years in industrialized countries, where the rate of dental and periodontal diseases used to be very high. But it has been on a slow increase in many developing countries, where such diseases have traditionally been of low incidence, as can be seen from this chart, measuring the number of decayed, missing, and filled teeth in children of 12 years. The need to take appropriate and timely action has become particularly urgent because of this upward curve. The process of development need not be accompanied by a deterioration in oral health. Knowledge about prevention has widened, and the type and quality of dental care available has considerably improved. It is now simply a question of spreading the knowledge and providing that care. All over the world, the most common oral diseases are dental caries and periodontal diseases. Dental caries, or tooth decay, is caused by bacterial plaque, a soft, almost invisible layer of bacteria which forms on the teeth and can produce an acid. This acid comes from the components of food and drink, especially from fermentable carbohydrates. It attacks the tooth surface and leads to cavities and tooth decay, causing toothache. Periodontal diseases start in the gums, caused by different dental plaque irritants. The first warning signs are gums that bleed easily and that may become swollen and tender, producing bad breath. More serious conditions can develop through formation of tartar on the teeth, destruction of tooth-supporting tissues, and eventual loss of teeth. Apart from these well-known diseases of the mouth, there are many less common and more severe conditions. Many people have crooked teeth, for instance, which can be straightened by orthodontics. Other diseases, on the other hand, illustrate the close interactions between general and oral health. Oral cancer is a life-threatening problem in all countries. It is related to oral habits, such as the use of tobacco. This cancer is the 6th most frequent in the world, and it is most common in the Indian subcontinent and in some countries in Southeast Asia. Patients with AIDS often suffer from oral lesions, like candidiasis, which affects 60 to 90% of these patients, and which is very painful. In fact, many of the symptoms associated with HIV can be seen in the mouth before the patient has obvious signs of any disease. This may be an early indication of HIV infection and help in the appropriate treatment of the patient. Another little-known oral disease, which affects mainly young children, is Noma, or cancrum oris. Although a very ancient disease, Noma has completely disappeared from developed countries in the 20th century. However, many cases are being reported, particularly in the most deprived parts of Africa. It is likely that the number of children worldwide who suffer from Noma is the order of several 100,000. This terrible disease, the cause of immeasurable grief, results from a combination of factors, chiefly malnutrition, infectious episodes, and poor oral hygiene. This disease is often fatal, and when a child manages to survive, it will probably never be able to speak or eat normally again. The common denominator for avoiding all these diseases, including the most common ones, dental caries and periodontal diseases, is prevention. In all the countries where these diseases have been successfully controlled, the key to success has been an efficient preventive program. This includes improved oral hygiene, the use of fluorides, and prudence in diet. As soon as children's teeth begin to grow, parents usually encourage them to brush their teeth. However, they often do not insist enough on the importance of regular, once or twice daily brushing, rather than on a quick passage morning and night in front of the wash basin, disposed of in a flash. Teeth and gums need to be thoroughly cleaned, and if possible with fluoridated toothpaste. The removal of dental plaque is essential for the prevention of periodontal diseases. Oral hygiene is an integral part of general body hygiene and should become a way of life. The discovery of the effect of fluoride on teeth was one of the major steps forward in oral health care, and indeed in public health as a whole. Fluoride strengthens the enamel of teeth and makes them more resistant to decay. It also inhibits the ability of bacteria to produce acids. Fluoridation of public drinking water has had a beneficial effect in countries where this is implemented, and it is recommended. Most commercially available toothpastes now contain fluoride, which is of great benefit to teeth. Fluoridated salt, milk, tablets, and rinses can also be used. Dietary prudence is perhaps the most difficult aspect of prevention, since it means revising all our attitudes concerning food. Sugar and fermentable carbohydrates eaten between meals, combined with inadequate brushing of the teeth, may contribute to tooth decay. Prevention of dental caries benefits from reducing the frequency and level of sugar consumption and replacing such products by vegetables, fruit, wholemeal bread, cheese, and milk. Fissure sealants are a further way of preventing dental caries. The dentist cleans away any pits and fissures in the teeth with a cleaning solution before applying a plastic film that will act as a sealant. Ultraviolet light can be used to set the film, but this step may be avoided in order to adapt this simple technique to developing countries. In the case of oral cancers, prevention consists of avoiding the habits that cause them. The main target being tobacco, used in all its forms. Smoked as a cigarette, cigar or bidi, reverse smoked with the lighted end in the mouth, dipped, placed in the mouth between the cheek and teeth, or chewed with other ingredients such as betel leaves, slaked lime, areca nuts, and so on. Health workers can be trained to check and diagnose early cancerous lesions and refer for treatment in order to avoid disfigurement, terrible pain, and eventually death. The prevention of AIDS-related oral lesions is obviously an element in the prevention of AIDS itself, but it is also important that health workers be trained to recognize such lesions, and if the patients are seropositive, inform them about how to protect those around them and help them by the appropriate treatment and referral procedures. Dentists have an obligation to provide safe treatment for all patients, including those that are HIV positive. They can also help alleviate some of the pain of the HIV positive patients by treating the lesions. Furthermore, their instruments need to be sterilized in order to protect other patients. As for Noma, a 5-point plan was developed by the World Health Organization, Aide Odontologique Internationale, and other associations for controlling Noma, namely prevention and early detection, emergency care service, etiological and epidemiological research, treatment of sequelae in other countries, opening of a regional center for complex treatment in West Africa. These are not easy to put into effect, and yet the amount of suffering and disfigurement, often leading to death, that this disease causes in children means that urgent action has to be taken at all levels, and now. Epidemiological studies and surveys can help keep track of the success or failure of prevention programs in different regions of the world. They are also of the utmost importance in developing or revising strategies. It is being increasingly realized that many health problems, among them major ones such as cardiovascular diseases and AIDS, can be avoided by adopting health-conducive lifestyles. This applies to oral health as well. For instance, traumatic injuries to face and jaws are on the increase in many countries. The use of mouthguards and helmets in contact sports should become more widespread. And the use of a helmet when riding a bike or a motorbike more strictly controlled. It is particularly important to keep on informing and educating populations at all levels about the risks of unhealthy oral habits. In many countries, sensitization campaigns are being launched with the help of schools, cultural institutions, and others to inform and educate special target groups such as parents, pregnant women, and school children about healthy oral behavior.
Les nous brosser, ouvrez la bouche grand, commence par dehors d'un coin. Et nous fait tirons.
A group of The mother was the same. La 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 la. The mother was the same. Goodbye to the toothache. Goodbye to the toothache.
Traditional modes of thought and practices, which include health-conducive messages, should be sustained or revived. In India, Ayurvedic medicine has always emphasized the fact that hygiene starts with the mouth. In Buddhism too, philosophical precepts emphasize the need for corporal hygiene, and that the mouth, as the door to the whole being, should be kept particularly clean. Oral care techniques have in recent years changed beyond recognition. Even dental surgeries have changed to a more decorative, less functional aspect than in yesteryear. Modern techniques are more rapid and efficient and less painful in that everything is done to prevent the patient from feeling any pain. It is now possible to replace missing teeth by dental implants and make fillings, crowns and bridges using computer-aided design and manufacture. However, the new technologies have considerably increased the cost of sophisticated oral health care and limited its access to urban dwellers, as well as to the more affluent members of society. Whereas people living in rural areas and the poorer sections of society sometimes are deprived of basic oral health care. This is why there is an urgent need for simple, inexpensive, and good quality care. New techniques which can be provided by health workers are being developed. One of them consists in removing only the dead tissue from the teeth and cleaning the cavities with a cleaning solution and small-scope hand instruments. The cavities are then filled with a glass ionomer cement which sticks to tooth surfaces and protects them, after which a clear film coating is applied as a protective layer. This technique is particularly adapted to areas without electricity, but can be used anywhere. The training of health personnel will have to be adapted to all these changes and new avenues of progress. The oral health worker of the future will have to be polyvalent and care for the community's health while providing information and counseling about prevention as well as about appropriate lifestyles. Concurrently, more formally trained dental surgeons are needed to cope with the growing needs, particularly in developing countries. Universities and dental colleges are now adapting traditional teaching methods to new technologies such as computers, interactive teaching, and closed-circuit television.
We must ensure that the adoption of new lifestyles and new eating habits does not lead to an increase in dental caries. In populations that have always had healthy teeth, health policies need to be adjusted. Staff have to be trained and appropriate services set up. Prevention among children and adolescents must continue. Health, well-being, and self-confidence are all boosted by good oral health. We have the tools. Action is urgently needed to apply them.
With the progress achieved in the field of oral health, there is no longer any excuse for not ensuring that we keep our mouth healthy. Simple hygiene and appropriate care can help avoid dental caries and periodontal diseases. But more importantly, now that we know the more serious conditions that can arise through certain unhealthy habits, we should take every step to avoid putting our own health and well-being at risk. This is the best means available to us today to make sure we keep a healthy smile on all faces.